Hey, I'm Dr. Jaffer. We're going to jump right back into our series on men's health. Today, we're going to be talking about chest pain. And this is a subject that's going to be helpful to everyone. So, the question about chest pain is what's the chest pain from? Because there's usually cardiac and there's non cardiac causes. Let's jump right into it. By the way, chest pain is the number one presenting symptom to emergency department. So, if you're having chest pain, you've got to think about the quality of it, the duration of it, the intensity of it. And when I say intensity, is it a 1 out of 10 or 10 out of 10 chest pain? Its onset, was it sudden? Was it gradual? What were the aggravating? What were the alleviating symptoms? Because all of this plays a role. However, if you wait to the end, I'm going to tell you how we view it in the emergency department. Now, let's talk about what cardiac chest pain looks like if you're having a heart attack. In general, and keep in mind, your body does not read medical textbooks, so everybody's different. In general, the thinking is if the chest pain is related to you having heart pain, meaning you're having a heart attack possibly, it's usually a dull, achy pain, almost as if an elephant is sitting on your chest. Then there's the aortic dissection. Horrible, crushing chest pain. And that's usually because the big aorta that runs through your body that starts up here, there's a little, it's tearing and blood is going through, is oozing in between the vessel. And then there's something called pericarditis. That's related to the heart, but this is less urgent. And that is inflammation around the pericardium of the heart, around the surface of the heart. And that's usually a dull pain. And if you sit up or lay back, the quality of it changes. That's really a treatment of Motrin and rest. By the way, nothing I say should be taken as medical advice. This is just for information purposes only. And then you got to think about the lungs, because the lungs can cause what we consider chest pain. Do they have a pulmonary embolus? And that is basically a clot that usually breaks off from your legs and it goes to the pulmonary vasculature and cuts off blood supply to parts of the lung. Yes, that is life-threatening. And so that presents with like chest pain. Pneumonia can present with chest pain. We know that's often just antibodies. And then there's something called pleurisy. And that's basically the lining around your lung cavity. It's inflamed. It's caused by a number of different reasons. It can be from a cold, leftover pneumonia effects, many different reasons. But then there are GI problems, GI causes to chest pain. When I say GI, I mean gastrointestinal causes. Something called GERD, gastroesophageal reflux disease. In other words, the acid in our stomach, it pops back into our esophagus. Let me explain differently. When we eat, there's a tube that goes down to our stomach called the esophagus. And at the very end of that, there's a valve that closes. However, as you get older, for many different reasons, that valve doesn't close as well. And so that acid, it comes back into your esophagus. It comes back into your esophagus. And that can cause chest pain. Additionally, gallbladder disease. That can cause what comes across or what appears to be chest pain. Now, I've spoken about many different causes and whether or not it's a crushing pain and an elephant sitting on your chest. Let me jump right into this. As someone who's practiced emergency medicine for over 20 years and currently practices, if you are over a certain age, if you have risk factors such as diabetes, high blood pressure, you are a smoker, you're over the age of 40. If you're having chest pain, go to the ER. There's no trying to figure it out. Is it dull? Is it how long has it been? That's what the ER is for. And I highlight that because even in the ER, when people present with chest pain, it usually takes us several hours to rule out or whether that's a cardiac cause or to find another cause. What's my point? My point is we have all this different equipment and it takes us several hours. So if you are over the age of 40, a smoker, high blood pressure, diabetic, and you're having chest pain, the best advice I can give you is to go to your primary care doctor, go to the emergency department, or call 911 to have it assessed. True story. I had a 45-year-old came in with chest pain, and he thought it was this, he thought it was that, and that was the reason why he didn't come in. He was having a heart attack. Again, if you don't learn anything else from this video, if you're over the age of 40, and especially if you are a diabetic, and that's just for many different reasons. If you're a smoker or have high blood pressure, don't try to figure out whether or not your chest pain is related to your heart or not. Either call 911, call your doctor, or go to the emergency department. And guess what? If you're wrong, we had a chance to meet you, and we had a chance to figure out what it was. Be well, and I'll talk to you soon.